So when I'm referring to maternal mental health, I really want to kind of be clear about the language that I'm referring to. And when we're talking about, parenthood and parents, this is a really inclusive term. This refers to moms, dads, grandparents, single parents, non-heterosexual parents, um, anything that is really a carer, someone who's the main carer or the responsible for baby. So yeah, I really want to kind of invite a really inclusive conversation about maternal mental health that is open, intolerant, and inclusive. And hopefully that will be really helpful in when we're thinking about the importance and significance of maternal mental health and the needs for anyone who's really struggling with their maternal mental health during the perinatal and postnatal period, and even afterwards. Thank you.
The perinatal period is not just for women. It's mum, baby, because it's a relationship, that's a dyadic relationship, also with father and potential carer as well. Yeah, and it usually, when we're talking about that period, it's one of massive changes. So it's the development and growing of the baby within the conception period to birth and onwards. And there's so many neurological and cognitive shifts that happen not only for mum, but also dad and baby. And so it's generally kind of also looked at as the 1001 days, which is the 0 to 2 period, which is that critical period for bonding and attachment and development. Yeah. Absolutely. That what you're talking about in terms of making sure everyone's held and secure and feeling safe is optimal for bonding, attachment, emotional regulation for both baby, for mom, for dad or carer. It's the moment where I believe parents and baby need the most support. I think there's just a range of difficulties. It could be a really difficult pregnancy, it could be a difficult birth, a traumatic birth, but also the huge adjustments that happen after the birth of the baby, the life transitions, a lack of support, sleepless nights, infant feeding difficulties, baby being unwell, to more acute problems such as domestic violence or homelessness or danger and threat. It really varies, that period, in terms of what could be the challenges. I think the challenges are really, really vast, and they start from not just when baby is born, but they can start much earlier. So it's important to kind of keep awareness about how those difficulties will be unique for each person, and sometimes it's about recognizing those difficulties as legitimate, and often mums will kind of normalize, or not normalize, sorry, they might disregard some of those difficulties and challenges and internalize it as they're failing, or that they're maybe not loving every minute of it, and it's about kind of raising awareness of how those challenges are real. Mm-hmm. Many mothers or fathers will diminish or kind of discount the real challenges that you have. It's important for mums, dads, or carers to recognize that they're not alone in their struggles. And 1 in 10, I think, mums report postnatal depression or difficulties. And I'm pretty sure that with COVID that has gone up. And I know with dads it's maybe possibly 1 in 5 recently, some of the statistics. But the message that I think would be helpful is that you're not failing if you're struggling, and the challenges and tasks are overwhelming. And, really asking for help, getting help, that early intervention is really important. I think it's really difficult to ask for help. It's quite a vulnerable place. You can feel judged, you can feel helpless even. And our culture, dads have to kind of go back to work after 2 weeks. There isn't that kind of network of communities and families that in the past was more routine. And with COVID, there's so many challenges. So there's all of that, and I think if things start to tip in a way where it's possible that you feel you are struggling, some of the signs maybe to look out for are just low mood that goes on for kind of further than the baby blues, and intrusive thoughts perhaps, or feeling low, feeling that you can't bond with your baby, not being able to kind of get out of the house, and really struggling with scary, frightening thoughts about yourself or harming baby, that's when it's really critical to kind of seek support from your GP, midwife, and external specialist perinatal. If you're pregnant and you're struggling, there's a Pregnancy in Mind, which is run by NSPCC, and it is online at the moment, but that's something that would be you could get referred through your midwife. If you've got if you've had the baby, and you're more than welcome for any of these organizations, you bring your partner as well. There's Baby Steps, that's with NSPCC. There's also Homestar. Part of the service that I'm developing with the Parent-Infant Program at York St. John Counselling Mental Health Clinic, we are looking to be as inclusive as possible, and that means that if anyone's listening to this interview and they think, oh, this is not my story, this isn't my experience, I will welcome that kind of feedback. We're looking for moms from LGBTQ, BME, and refugees, homeless women, and also women in prisons, and any story that you feel is your story. It's important for you to get in touch, because we want to incorporate that feedback within the service, and that is something we're really passionate about. At the end of the day, they're the mums and the dads and the carers are the experts. They know their baby, they know their story, and we're about guiding and helping and listening and being aware of that story. Yeah, so absolutely, at the Parent-Infant Center, so the Parent-Infant Therapy Program, that is all about welcoming dads, our carers, and mums, to be as inclusive and involved as possible. It's really critical. It's actually a really key component. We want to incorporate that. And I know that with some of the other programs I've mentioned, Pregnancy Mind and Baby Steps, that is also inclusive of fathers as well. Mm-hmm. Yeah, I think there are different challenges, and I don't want to make too many generalizations, but sometimes dads will feel they don't have a right to some of their anxieties, or maybe even feelings of depression, and that it's all about mum, and so that gets shut down. And we have to remember there are huge transitional shifts that a father will or dad will face, and also they don't have the same kind of maternity leave. Shared parental leave is still not something that is widely understood or taken, and so they might experience a kind of level of postnatal depression in their own way, but we don't even have that kind of narrative in the culture that permits those feelings in a way, and men can tend to internalize that a bit more. So I think, and similar to what mums might experience with sleepless nights and sleep deprivation, low mood, and also the possibility of kind of old traumas being resurfaced from their own past. This could all be experienced with a new father, and again, not having that network of support or even work understanding that, hey, I have to be at work at 8 a.m. and I have had maybe 2 hours of sleep, which is a big factor. I think for anyone listening, that you're not alone and you're not failing, and to really normalize some of those great difficulties, and the help is there, and to get in touch as early as you can, and that would be and also just to kind of give my own admiration that moms and dads and carers go through by bringing a new person in the world is really, really hard. Yeah, so I think it's a really important question. If you can have all the knowledge of mental health and be aware of it, and still that asking for help is really challenging. And I definitely suffered with PND with my second daughter, and it was very, very challenging to admit it, and to recognize that I did need some help, and that it was okay, and I wasn't failing, and that it was really normal. My circumstances were really challenging. I had 2 young children back to back, and didn't really have a local network, and so these these factors make you quite vulnerable and exacerbate the challenges that one can face with motherhood or parenthood. And I'm really grateful that I was able to get that help, and and it's made me more aware of how it's so important to be able to ask for help, but also to be able to get the help as well.